Welcome to Decoded, the future of health, the podcast where we explore the breakthroughs, ideas, and global movements redefining precision medicine and healthcare AI. I'm Dr. Vinod Gauba.
And I'm Darren Brodeur. In this series, we're speaking with leaders from around the world, people transforming genomics, health data, artificial intelligence, community governance, and national innovation strategies.
At the heart of these conversations is one urgent question. How do we build a world where every population can contribute to and benefit from the science and healthcare systems of the future?
We'll be hearing from pioneers in the Middle East, Africa, North America, and beyond. Each conversation helps reveal the ideas, systems, and collaborations redefining how the future of health will actually work.
So with that, let's get started. Today, we have the pleasure of speaking with Professor Zawati, a global authority in health data governance and co-chair of the AI Working Group at the Global Alliance for Genomics and Health. He joins us all the way from McGill University in Canada. His work shapes the frameworks that determine how genomics, data, and AI are used responsibly around the world.
Man, great to have you with us.
Thank you. My pleasure.
So, man, when you look at today's global health data environment, where do you see the biggest gaps in governance and trust?
This is a very good question. First of all, thank you for the kind invitation to speak to you today. I think one of the challenges that we have at the moment is one of trust. And to be able to work from an international perspective, you need to have international interoperability. So one of the gaps is trying to break through those silos as much as possible for initiatives around the world. I mean, there's excellent initiatives happening, but sometimes there are initiatives that are happening, each one of those in their own place, and the challenge is to try to bring them together through a common language. And governance is really one of those languages. Good governance is one of those languages. And again, without that, what ends up happening is that people do not trust. They feel like there is, sort of a feeling of, well, there's no impact that's happening. We're seeing a lot of these projects moving ahead, but without that impact. And in order to do that impact, we need that collaboration. We need this capacity to work together under general principles, even of universalism, where we're all in here together. So this is one of the challenges that I would say is one of trust and international interoperability.
And man, how do those gaps limit scientific progress or cross-border collaboration, in your view?
Yeah, I mean, so one of the challenges as well is you can build one of those really great initiatives and programs, but at some point you need this, diversity. And we were, having a panel not too long ago where we were talking about this. When you don't have enough data that's being shared, you don't have that diversity, and that what it does, it basically, does hard encoding of inequity in science. It creates scientific bias, and if you're thinking about translating this, the only way it's going to be translated, the scientific bias, it's potentially in clinical harm, right? So if you're not really able, I'm just thinking about this from a precision medicine, and I like to use this analogy a lot. It's like you're going to a store and you're trying to buy a nice suit. Well, you can buy something off the rack, which could fit and may not fit you, or you can buy something that's tailored, right? It's truly more expensive, but still it's tailored. It looks well when you wear it. And if we don't get your metrics, if we don't get your actual sizes, we're not going to be able to tailor it for you. And so this is, kind of similar to some extent with science, with information. If we're not really able to share, if we're not really able to collaborate together, we're not going to be able to attain this richness and this capacity to generalize this information. So there is an issue of potentially doing some hard encoding of inequity in science.
And nothing highlights that more than when you start talking about AI,
Yes.
right? And I think there's growing recognition that AI is only as good as the diversity of data that's behind it. And from a governance standpoint, What concerns you the most when data sets lack that diversity and inclusivity?
Yeah, I mean, other than hard encoding this bias into science or this inequity into science, for me, there's this idea of creating and developing models that actually can travel, right? So if you're building algorithms or you're creating these models that are not diverse, first of all, it will exacerbate already existing inequities, really exacerbate them. But at the same time, they're not going to be generalizable. And we're not going to be able to, really understand its effect on society, because this is the foundation of how society then reacts to science. And if they can't travel, it means that there are some countries that will always be reliable on others, and so they're not going to be able to be part of that conversation, that international policy-making conversation. And I think that brings me to the next point, which is if you actually don't do this properly, it undermines global policymaking. Our goal is to really, and organizations like the Global Alliance for Genomics and Health is a great example. I co-lead its regulatory and ethics work stream, and our goal is really to bring in as many voices as possible. There is richness in all of the different cultural, legal, ethical, sort of ecosystems that exist around the world. But if they don't have the chance to actually be in front of this technology and be able to react to it, whether legislatively or from a policy perspective, they're going to miss out. It's a missed opportunity at the end of the day, right? It's a missed scientific but also ethical opportunity.
And isn't that one of the biggest fears that, AI could actually deepen the inequity?
Yes, I mean, if it's not using diverse data, that's what's going to happen. But again, I'm an optimist.
Yeah.
I think one of the very important things that we're doing is that we're actually identifying where we see the gaps or where we see the issues, as we've done now. And the goal is to work together on solving them.
Absolutely.
So speaking of the gaps that remain unresolved, what form of inequity do you fear the most?
Well, I mean, I see this from different angles. I think there's a scientific, kind of element to it. If I'm not able to give you or provide you with a treatment or with a therapy that will actually be useful to you because of your background, um, we miss something very big here. But for me as well, as I'm hoping to be able to empower also regions that have unfortunately historically been left out in the conversation. Um, you know, you can have an initiative that has the technical capacity, that has the talent, but doesn't have the policy or data governance capacity. This is because that particular place hasn't been really able to to endeavor into that or create programs. So capacity building is a must, and I fear inequity there, where you have the data that's been collected but not being able to be shared because you don't have the mechanisms that are in place, or you haven't really been able to develop a process that is actually kind of more attuned to your regional kind of perspective, while allowing you to work internationally. And again, this I think comes back to this ability of sharing this information widely and in a way that will allow us to achieve that kind of diversity.
Absolutely. And then just coming back to AI, you're the co-chair of the AI working group for the
Yes.
Global Alliance for Genomics and Health.
Yeah.
So effectively, you're setting the global standards. What are the absolute non-negotiables when it comes to setting those standards for AI to work responsibly in genomics?
Yeah, I think first of all, we need to know what we're talking about, right? Because I mean, AI has become to some extent a buzzword, internationally. People talk about big data, but they mention AI, and they're like, well, you know, there are some elements in there, but it reminds me a little bit of the conversation that we're having about genomics 20 years ago, where genomics was to biology what AI is to data now. I mean, we're talking about a lot of hype, we're talking about abundance of data, but we're talking also about the ethical, legal, and policy issues that we need to anticipate. in order for it to be able to be used in a responsible way. So I think first is really being able to provide the rich tapestry of what we're talking about. There are different forms of AI, kind of approaches. And so that it starts with that because each one of them has their own issues and challenges and opportunities. I think the second thing is to think about the concept of transparency, right? And it's one that is a little bit challenging in the world of AI, especially when we're talking about black boxes. Uh, Sometimes technology, kind of brings things to the fore, and then legislators or regulators decide that, there are principles they need to be put into place, but without necessarily having that dialogue that allows you to understand the limitations and what are the possible avenues you can take. So one example of this is explainability. It's one of the hardly explainable principles, right? Because when you talk to AI developers, they'll tell you there are limits to what we can explain. I mean, this is how the model is built. But then when you talk to legislators, they're going to tell you, well, no, you do have, this is a duty that you have, right? So how do you, kind of bridge those different, kind of perspectives? And so transparency is key. Accountability is key, right? Accountability is, I guess, at the heart of trust, and being able to, provide mechanisms in place when it comes to responsibility to liability, and benefit sharing as well, right? We do talk about different power dynamics that currently exist. And when you are able to have a conversation where benefit sharing is part of it, I think it's a different type of conversation, right? Because there is always a reciprocal, kind of um, model that is being proposed here. So I would say these are the kind of principles that are at the heart of a lot of the work. And then we can talk a little bit, more about the environmental aspects related to AI and what it does to societies. But I would say these are kind of the three main um, or important tenets that always come back to this word trust.
As you're well aware, we're seeing new models of global collaboration emerge that do not require data to actually be moved. How do you see this influencing research and trust building in the coming years?
Yeah, I mean, I think it's quite important to also get a sense of what are the different models that are out there, right? So you have the models where all the data is in one place, but there's limitations to that, whether they're kind of infrastructural limitations, or there are sometimes legal limitations. There are some countries around the world that have enacted certain policies or certain legislation that limit the ability to actually move data, and there are different models that currently exist. I mean, federation is a good example of that. And also, data visiting is another one that we're also talking about, and that G4GH is working on as well. Um, but I think we have to remember why we're doing this in the first place, right? So when a participant comes in and says, "Here's my data, and here are my samples, and I would like you to use it for science," you're not really promising them anything other than actually maximizing on their use. So finding ways where the data isn't siloed and the data is actually accessible, discoverable, is a way to, kind of satisfy that promise that you have made. And so data sharing isn't only a scientific imperative, it becomes an ethical imperative as well, which again brings us back to this hopefully virtuous cycle of trust. So the idea here is, if there are limitations to what we can do with the data, we can at least share standards. We can at least share policy tools and templates that people can use, because it's not just a technical thing. It's also one of interoperability. So if we're all going to be talking the same language, then it's going to make it easier for us to be able to do that collaboration. And I think it all, comes back to having good governance mechanisms, but also capacity building. It's really, again, we're talking about power dynamic, but it's really different when you have someone speaking from a country about their legislation, their laws, and they have probably a longer history of enacting those, and someone who doesn't really understand or comes from a different, kind of perspective, it's not the same kind of power dynamic in those discussions. If you bring that capacity up and you make sure that this, the country itself or the people who are working in that field do have that capacity to discuss these policy issues, then it becomes a different type of conversation. It's one where the power dynamic will change.
And in speaking of governance, what would you say are the governance structures that strike the best balance between local control
Yeah.
versus global benefit?
Yeah, and this is one thing that we're constantly kind of talking about and deliberating about. I don't think they are necessarily mutually exclusive, right? There is an ability to maintain a certain level of control and custodianship locally, for the benefit, of course, of the local population, with the understanding of this at an international level will also have an impact. You see this as a process, that's staged. One is, local, where we collect the data, we, bring in our researchers within the country to be able to use the data, to be able to advance science, bring in talent, but at the same time, if we really want to maximize on it, we have to understand the importance of sharing that data and making it available again for diversity perspectives from making sure that we don't have these types of inequities, in the long term. But at the end of the day, if we want to do this correctly, we need to make sure that we have the right, sort of expertise around the table, to allow this to happen. And there are, I'm a lawyer by training, so
Yes.
I'm solution oriented. So there's always a way forward, a path forward of understanding sometimes the concerns that are local. And we've had situations in the past where there was abuse, there was, some kind of level, and there's mistrust, with certain collaborations. So we have to understand where that's coming from and work to make sure that it doesn't happen, to palliate some of those, because again, we're talking trust between the public, but trust is multilateral. It's a trust with the public, trust with the initiative, trust with the participants, the patients, but it's also trust in the ecosystem. And if you have a mistrust somewhere, it doesn't affect only that group. It affects everything else.
Yeah, mistrust spreads like wildfire.
Exactly.
Right.
Exactly.
And I guess transparency, as you said, is just such a critical part of,
Yeah.
of that engagement forward.
Yeah, definitely.
So if we look 10 to 15 years ahead, what will distinguish the countries or institutions that succeed in building trustworthy and globally relevant AI systems?
I think you've just named them, right? So there is this aspect of local impact and success, but global outreach as well. Again, it's at multiple fronts. It's at the scientific front, where you're able to show the population that this endeavor is actually meaningful and it's actually yielding results, which, for a lot of these projects and a lot of these models and a lot of these tools, not necessarily quick. It takes time, but it has to be sustained, and the ability to also showcase openness from an international perspective. I mean, the pandemic was you know, bad, but also a good example of why it's important to work together. And this is why you've had a lot of statements and a lot of institutions around the world, calling for, more collaboration and more sustained collaboration, is because it's not going to only happen in one place. It's going to happen in multiple places. So this is an example of where this type of collaboration and global outreach becomes very relevant. So success probably would look like the ability to showcase and yield those results locally, to continue sustaining that trust within the population, but also building bridges internationally, whether it is from a scientific perspective, whether it's from capacity building, and just really having a place at the table of those deliberations and those discussions, thanks to multiple organizations who, their mandate is actually to do that.
Exactly. Exactly, man. Thank you so much for sharing your perspective with us, which is such an important part of this discussion. Governance frameworks, particularly when we talk about AI and the future trajectory of that. It's extremely valuable insight. Thank you so much, man.
Thank you for having me. It's a pleasure.
Likewise. Man, thank you. And to our listeners, stay tuned for more voices shaping the future of health.